In today's video, I'm chatting with Courtenay Polock, who is an accredited exercise physiologist. Limited access to specialists, long wait lists, and lots of travel to access specialty health services prompted Courtenay to establish her practice so that she can provide accessible services to people in need. Courtenay is passionate about women's health and has a very strong skill set in exercise prescription for complex women's health conditions, including endometriosis. In our interview, we discussed the importance of exercise for endometriosis, how to approach movement as somebody who is new to endo and or new to moving your body in a way that's consistent with living with chronic inflammation. We spoke about strategies to use during an endo flare or to mitigate an endo flare, top tips for moving your body with endometriosis, and physical signs your body may be giving you that might indicate a pelvic floor or mobility concern. If you haven't already, please give this video a thumbs up, share with a friend, and subscribe for the best endo and fertility content here on YouTube. Welcome. Thanks for being here.
Thank you. I'm excited.
Just to start us off, Courtenay, can you give us, our listeners, a brief intro, who you are, what do you do, what is your area of expertise?
Yeah, I'd love to. So my name's Courtenay. I am from Australia. So for anyone listening that's from this area, exciting times. But I am an exercise physiologist. So I also think there's a bit of discrepancy what that is for people and what that means in comparison to personal trainers and physical therapists. So I might talk a little bit about that. Do you think that would be helpful?
Absolutely.
I basically use exercise prescription to, let's say, create a stimulus for the body to adapt to. So we look at more like cellular response to things and how the body needs certain different things for it to work a little bit better. So that could be in relation to chronic illness, chronic injuries, a lot of different things. So that's what an exercise physiologist actually does. I specialize in women's health and in particular the pelvic health side of things. So women's health being like the category that could be anything from pre and postnatal care. It could be safe exercise during that time, rehab. It could be in the like oncology space where we're looking more things like breast cancer or things like that. It could even be with like PCOS, endometriosis, pelvic pain, anything sort of specific to women's health. And in regard to what I really go into is pelvic health. So think about anything related to the pelvis and the pelvic floor. That is where I really sort of like dive into my work. So I run a completely virtual clinic. So everything is online and I help pretty much everyone from the comfort of their home, which in most scenarios is extremely helpful when we're talking about pelvic floor. So this is my clinic. Welcome. But yeah, that's a little bit about what I do and what I'm here for, I guess. But most of it's exercise prescription, or we think about it more like rehab-based work that helps anything related to pelvic health and pelvic dysfunction. So hope that makes a little bit of clears up what I might do.
Yeah, that's amazing. You had an awesome reel that I watched in preparation for our chat today explaining like exactly what you do. I found that so clear. I was curious, Courtney, just briefly, if you could give me an example, not just me, but our listeners, an example of like what I'm envisioning in my mind is somebody comes to you, they have this like specific problem. Let's say it's like bladder pain related to endometriosis, right? And then what I'm envisioning is you're identifying that that's the problem, and then you're ultimately like recommending or prescribing a certain form of movement. Is that right?
Yeah, yeah.
Yeah.
So I
Awesome.
think about it like what movement is going to help with the symptom management of things like that. And that could range from what does the actual exercise choice look like? What does the intensity look like? How many reps and sets and volume are you doing? How much rest do you need? What other movement might be impacting that and not actually helping with your results, but making things worse?
Mhm.
How you are doing the movement, at what point in time are you engaging the right muscle, breathing at the right time, things like that. It's actually like very prescriptive. So I think the
Mhm.
reel that you're talking about, I talk about it more like if someone gave you like a prescription of medication, it would look like take this 2 times a day, daily for 3 weeks. And then after that, you would taper off. Like we do the same with exercise and movement. Like this is what you got to do, how many times, what days of the week, when you need to rest, when we need to change it. And the body
Mm.
gets used to it and we need to switch things around. It's like prescriptive exercise.
That's amazing. So could you be doing exercise wrong?
This is a very juicy conversation.
Okay,
I
let me rephrase it if it's not an easy question to answer
No,
because
no,
like
it's easy to.
it is. Okay.
It is, but I think there'll be opinions on this.
Okay, we like
I think
controversial opinions.
Yeah, I think it for us when we exercise physiologists, or we call ourselves EPs here in Australia,
Okay.
we use exercise for particular problems. So if the person is presenting with something, the purpose of the exercise and the intervention is very intentional.
Mhm.
And so if you did it wrong for that person, it could impact them differently to someone who doesn't have that condition. So I would say that in general, exercise is not wrong and you're not doing it wrong, but it could be not beneficial for you because of the stimulus that that particular exercise does for your body that is maybe not essential or necessary. So, for example, it might be that your body needs more lower intensity exercise. So if you're doing high impact exercise and overtraining all the time, that's going to significantly contribute to things like inflammation levels, which
Mm,
I think down being that we're going to talk about endometriosis.
yeah.
So that is probably not beneficial, but maybe it's also not at the right time now in your journey. So you might find that that exercise prescription is good, but only once you've done some things before to
Mhm.
like get your body to tolerate that amount, and you have diet in play, you've got lifestyle in play, and everything's contributing to managing things a lot better. Yeah, yeah, I think so. I mean, it's a fair question for anyone, really, because
Yeah.
exercise is so essential for just general health.
Yeah.
So when we look at what we do, like, if you, we all know that if you live a pretty sedentary life and you don't do any exercise, health is not, it creeps up on you, health issues. So, avoiding it in general is just generally going to be not that great for you. But especially when we look at endometriosis and we have chronic levels of inflammation and you're avoiding exercise for certain issues rather than just not doing it because you don't want to exercise.
Mhm.
We're looking at the long-term health effects of what does that do to the body, high levels of inflammation or not doing enough movement in general. So we're going to have issues with cardiovascular health, metabolic disease, even things with insulin sensitivity, things like that. Weight gain or changes in body composition, loss of muscle mass, which is super important. That eventually will impact your bone health later on in life. There's mental health component to it as well, because we know that there's a huge mental health component to any chronic pelvic pain condition, especially with like endometriosis being one of them. So if we can do a lot of things that help with that hormonal response for mental health support, super helpful in that sense. So there is a really important role for movement, shall we say, as well. I really like to use that term a little bit more than exercise sometimes,
Love
because
it.
I feel like exercise has this label of like, go to the gym and do 5 days a week of all this HIIT training.
Mhm.
And we're like, let's just move a little bit initially because you don't
Yeah.
have the ability to do that.
No.
And what that movement might look like could be just generally going out and doing some like kayaking or something. Like it doesn't have to be structured as well. So I think both of those categories become really important for managing
Yeah.
endometriosis and helping with so many different parts of it.
Yeah, I love that you said that because I was actually at the gym with my husband this morning. And in my head, I was thinking, like, so we were doing resistance training, but in my head, I'm like, I would love moving my body so much more for the rest of my lifetime if I was doing things that I actually liked, like swimming in the ocean and
Yeah.
rollerblading or kiteboarding, you know what I mean? Not just this like resistance training, which makes me feel good, but I kind of find maybe a little bit boring. So I love that you said that about movement, right? Not exercise.
Yeah, so if you don't use it, you lose it, which is pretty essential. And it's a very big component to like metabolic health and just general function. So it is important to be doing resistance training. But I personally see a lot of pelvic pain exacerbated from lack of strength in certain areas as well, and inability to tolerate certain movement patterns. So whether you're doing particular movements that cause you more problems and other ones don't, it's usually a pretty big sign that there's like muscular imbalance there.
Yeah.
So not only is that pretty problematic, but in a sense of when we're looking at bone health, this is something that's really, really essential in the future. When we go through menopause, it tends to naturally decline, and you're at risk of osteopenia and osteoporosis, which then puts you at risk of bone fractures. So if you're not loading the bone through like muscle loading exercises, which looks like strength training or plyometric exercise, which is usually very not very tolerable for those with endometriosis,
Mm.
then your bone health could drastically decline, such that you are now at risk of osteopenia, osteoporosis. And if you were to trip over in your future, which looks like a bit older because you're not very strong, we're having a bone fracture, that significantly increases your risk of mortality as well. That's a high risk associated with that. So like that to me is actually quite crucial, but that starts when we're like going through puberty. That's when your bone health is at its prime, early 20s, and then it slowly declines anyway. So muscle mass from that perspective is, I think, is the most important part of why we need to be doing it. Symptom management for pain, but then also future health and what that looks like.
A lot of people with endometriosis, I'm sure you see it all the time, struggle with exercise because of chronic pain. Maybe there's pain in certain areas. Maybe there's core dysfunction. How do you respond to that? Do you have any advice to offer? This is
Yeah.
probably a very loaded question for you, actually.
Yeah, this is a big question.
Depending on the person, it would be hard to respond
Yeah.
to, I assume. But maybe a general overview, like imagine you're somebody, you're new to movement, you have endometriosis, you know that it's an important aspect of good health. What are some of your tips? What's your advice? Yeah, I don't know if I should be a little bit more specific.
Yeah, no, this is a good question because I feel like something that lots of people that I see here is,
Mhm.
oh, you have this inflammatory condition. You need to incorporate more movement for that whole
Mhm.
anti-inflammatory
Mhm.
response. And they're like, I've tried and I just have more pain. So I can't do the movement. And then I'm back in this cyclic pattern of trying and then having to like bed rest basically for a couple of weeks to recover. And then I try again and the same thing happens. So it's not just as simple as like do more movement, because that's not solving your problem. So when we look at why exercise causes pain, there are many different reasons that feed into that. The biggest one is initially that is there are significantly high levels of inflammation already. And then we go and challenge our body in ways that is also uh, it is it causes like inflammation, but it also has an anti-inflammatory effect at some point. Like we have to create a little bit of damage in the muscle tissue and in the body for the body to go, oh, I need to get better at this. And it rebuilds in a stronger state. So there will be an inflammatory response, especially in high impact and jumping or heavier lifting, where you get that muscle soreness after as well. So we're going to add more inflammation to the area. But we also have this really sensitized nervous system, which it means that lots of sensory input can also be extremely, let's say, overwhelming for the body as well. So when that happens, usually your ability to tolerate anything that provides additional load to the body is very low. So that's where we get lots of high fatigue levels. Pain flares up because we're very heightened and sensitized, and anything that's causing this pain is going to be crazy. But there's also this lack of muscle function in the way the tissues work. So because of the body and the way it is affected by endometriosis. So this isn't primarily endometriosis itself causing this problem, but it has these downward spiral that then impacts muscle tissue, that makes the muscle tissue stay in like a really stuck, shortened state. And we really need this mechanism of like lengthening through muscles. And that doesn't look like just holding a stretch. That looks like teaching a muscle what we call eccentric control. So the muscle needs to be able to let go and lengthen. And that's where we get like, I think about it like a little bit of a tug of war around a joint. One muscle is going to pull really hard because it's really, really, really tight. And the other one is like really lengthened and doesn't work very well. So then when we do things like a squat or a lunge or walking, then the really tight muscle group does everything. The back one doesn't do anything. We get this sort of like unbalanced pull at the muscle joint, irritating the joint. So then we get this like excessive pain because that's what would happen in someone who just had general tension and not endometriosis as well. Like we look at general dysfunction through the pelvis, the back, things like that. So really, really important that we teach the body how to deal with all of those things first, which looks like maybe down regulation activities, which we can talk about a bit more if you'd like. It looks like teaching muscle function properly. So like what does lengthening a muscle look like? What does contracting that muscle look like? Which ones in your body are problematic? So it might be that someone needs more like this is diving into the science behind muscles, but like glute max exercises are usually really important, which is like the big glute muscle on the back of your pelvis, and not what we refer to generally as like a clam exercise would work a lot of deeper hip muscles. So sometimes that will irritate the problem rather than support. So the choice of exercise then becomes important to uptrain the right muscle group. When we bring a nice even balance, so the tug of war is now in the middle and everything's working really well, then we can go into things like squats and lunges where we're now working through that position properly.
Mm. That is so
Hopefully that
fascinating.
like,
That is
I
amazing.
feel like there's a
What?
lot of information there.
No, that was great. I did tease some of it apart that I want to ask you a little bit more about, but I was just curious right off the bat. What percentage, maybe anecdotally, unless you have like a stat that you can refer to, but in your practice, let's say anecdotally, what percentage of endometriosis patients see a positive effect on pain levels with these types of like targeted exercises?
Oh, I don't have a specific statistic for this from any research papers because, to be honest, there's not very much research
Yeah.
on
So then
like
anecdotally,
exercise outside of stretching.
yeah.
But in my practice, because I do like a pelvic pain questionnaire and I do a central sensitization questionnaire at the beginning, and then we reassess at the end of their programs, I would say 85 to 90% of my
Yeah.
clients will come out the other end
I
with
thought
like
so.
not much pain, or it's very manageable, doesn't last very long. It might flare up closer to the menstrual cycle, like their period or ovulation. And then they have all the strategies to downregulate that and manage it, and then continue with their program. Yeah, the
Could you
key to
elaborate?
most exercise programs initially. Downregulation looks like nervous system downregulation initially. So
Okay.
I talked a little bit about that, like extra hypersensitive system. That's coming a lot from nerves in the area being
Mm,
over basically affected by the condition ongoing and then being really, really sensitive. But that puts us in this general system of like your body being in like a sympathetic state. So if anyone's listening, they might know like sympathetic, parasympathetic nervous system, and one of them's like get up and go. That's sympathetic. The other one's like rest, digest, sleep really well. That's
mm,
your parasympathetic. So when we're in like a bit of a heightened sensitivity state, we're going to go more into this sympathetic state, which means like everything is on. Like we're basically in go. We have trouble sleeping, like feeling a little bit heightened, always tired, muscle tension, things like that,
okay.
digestive issues, which I mean, that's already something problematic for endo anyway. But that is driving a lot of problems. So that's going to drive a lot of flare ups after exercise. It's going to drive a lot of tension in the muscle groups, tension through the pelvic floor because the signaling system is affected. So if we can then down regulate that nervous system and teach the body like it's okay to like switch down a little bit, it's safe. Like we can tolerate these things, then we can then have more capacity to do things with extra load. So once we can down regulate that, that could also look like muscle down regulation. I can sometimes refer to that. So that would be which ones are really dominant and we need to like tone that down. Pelvic floor is usually a big problem because it's so tight and on,
Mm,
and we
yep.
need to teach it to relax. So that's a down regulation kind of, I guess, description.
Okay. When you're saying down regulation, so it sounds like you're referring to two things, like the nervous system piece, which would
Yeah.
that be like deep breathing and like is that
Yeah, like
what you're
things that
referring
are like
to?
super. Yeah,
Okay.
I think about like yin yoga, deep breathing,
Yeah.
joyful activities, spending
Yeah.
time with family and loved ones, things like that.
Okay, cool. And then you're also talking about down regulation specifically of the muscle, which I would imagine is
Yes.
stretching type of thing.
Like, I'm not sure about this one.
I mean, this
That
is
could look
your
like,
area of expertise, not mine.
yeah.
So.
Yeah, no, I mean, stretching could be part of it, but for me, that looks like release work initially.
Okay.
That's a down regulation of like tension, but then we also need to teach it maybe that eccentric control. So like
Okay.
lengthening through the tissue and teaching it how to like not be stuck contracted the whole time.
Okay. I
Like, let's
don't
get it
know.
to like switch off a bit.
I don't know if this is a complicated question, but is that just like a type of uh movement that you would do to do that? Or is it like
It depends on, yeah, it depends on the muscle group.
okay.
So,
Yeah. Okay.
like, let's take example. The pelvic floor is a big driver of a lot of problems because it's so central and it's part of our central stabilizing system. So when we're going into do any exercise, you have to be stable, and that generally tightens up and causes a lot of referral pain out to the other parts of the body. So that looks like understanding how to actually relax through your pelvic floor. That means like teaching it to turn off a little bit and not off completely because everything will fall out, but
Right.
understanding what it feels like to like,
Okay.
contract and lift and then actually let go and relax. But like that would look different for maybe a deeper hip muscle. That's like we can't teach it, it's taught differently depending on which muscle it is.
Okay. What does it in general look like? Is it a combination of like different types of stretches, deep breathing,
Yeah, it's
massaging?
like activation exercises and
Okay.
relaxation. So, really like rehab, like laying on the floor with your feet on the wall, like teaching your
Okay.
brain how to like relax and contract.
Okay. Yep. I'm visualizing
Yeah.
it. Okay.
Yeah, like
Perfect.
real low key.